We are here with Clay Yarborough, and Clay, I'm recording now.
Yes.
Talk to me about your medical freedom bill.
Thank you. No, I appreciate the opportunity to talk about it. So the Medical Freedom Bill, Senate Bill 1756, that we began moving in the process this week, has three main parts, and it makes great strides to ensure that Florida parents can make educated medical decisions for their school-aged children. So part of the bill clarifies that the Surgeon General's authority to order any individual to be treated during a public health emergency does not include authority to order an individual to be vaccinated. It doesn't mean that if we're in a state of emergency that the Surgeon General couldn't order someone to be isolated or quarantined if they pose a risk to, the greater public health. But if they need to be medicated, we want to make it clear that it can't be a forcible vaccination against their will. So that applies broadly, not just to school-aged children. But for school-aged children, what we're doing is, just like we already have an exemption based on religious beliefs in our law, if a parent would rather opt out of having vaccinations for their children as a condition of school enrollment in Florida, we would be coming alongside that and adding a conscience-based objection if a parent chooses to do that. So just for clarity, we're not removing any vaccines. We're not banning any vaccines. We're just giving parents the option. Maybe they're compelled by something other than a religious belief, but they don't have any other avenue where they could, truthfully file an objection. This conscience-based objection part of the bill would allow them to be able to do that in good faith and register that with the state. So that's the second part. The third part allows ivermectin to be sold behind the counter without a prescription, whereas right now you have to have a prescription to get ivermectin. So the pharmacist would be able to give information to people, but if you're 18 or over and you want to get ivermectin, then you are certainly free to do that without a prescription. So that's the main three parts of the bill.
I want to get your opinion just because today, last couple days in Northeast Florida, we're hearing in Jacksonville and now one in St. John's, cases of the measles popping up. Some medical professionals have come on our air saying, the kids need to be vaccinated. Your thoughts with that being a topical, timely issue in Northeast Florida right now?
Right. No, very good question. So we're monitoring that, and I also have been looking at statistics for the last 10 years of different cases we've had in Florida and what our vaccination rates are and all of that. What we need to remember at the root of what our effort is with medical freedom in Florida, just like we've done for the past 3 to 4 years, is make sure parents are in the driver's seat and that they can make the decision they believe best for their children in Florida. With regard to, of course, education, we've done that, but with regard specifically to this, related to healthcare, and if parents wish to vaccinate their children, they can. We're looking at what's going on with measles and all. We haven't seen overwhelming numbers of that over the past several years, even since COVID, when we've looked at that and even some of the other viruses out there. But what I can tell you factually is, just like in other states where they afford both a religious and a conscience-based objection for vaccinations as a condition of school enrollment, several other states who have pretty high vaccination rates, like Florida does, which ours is just under 90%, they still don't have a significant amount of disease outbreaks or other issues that we know about. So vaccination levels right now appear to be sufficient to prevent sustained transmission, even with exemptions on the book. So all that to say, yes, we're aware of what's going on in Jacksonville. Certainly, I'm very sensitive to that, with that being our area and being home. But we're trying to strike that balance with letting parents make the decisions, because they should be able to do that and have the right to do that, and still keep the public health broadly in mind as well.
Would you say bills like yours are contributing to cases like these because there is an incentive or more knowledge from parents to maybe, in their minds, incentivize not vaccinating?
I wouldn't make that assumption, because just because we, again, like with other states, I'll give you some examples, and this is per CDC information as recent as the latter part of last year. Other states, like Idaho, for example, they saw less than 10 cases of measles each year in 2024 and 2025, despite having an 80% vaccination rate. Alaska had an 84% statewide vaccination rate, and they didn't have any measles cases in 2024, and they had less than 10 in 2025.
But Alaska is a very sparsely populated state compared to
True.
where we are.
True. Well, and that's true. So Iowa, 90%. Hawaii's at 90%. Arkansas, not quite like we are. I mean, we have a high population like you're talking about. But my point in saying all that is we're not necessarily seeing, just because more parents are choosing an exemption, like in Arkansas, for example, they changed their law back in 2003 so 23 years ago, to broaden to include a conscience-based objection, but they did not see a commensurate spike. And they've had a couple of situations here and there, but they didn't see, like, within even 5 or 10 years, a spike in various diseases that one could point back to and say, well, yep, it's because of this that they saw that. So I am not of the belief that we will see that. Could it happen? Yes, I can't rule it out, but we don't have evidence in front of us to suggest that by doing that, we may see more opt-outs, but at the end of the day, is it going to cause, major health problems? Is it going to mean that we have vicious outbreaks of sustained transmission of disease and things like that? Based on the research I have, I don't see that would be the case. So,
and I'm sorry to clarify, I missed.
Okay.
Did you say the vaccination rate? What our percentages? I missed if you said that.
Let me look back. So ours in Florida, this is as of the end of 2024, we're at 89%.
Is that on a specific vaccine or all vaccines?
That's fully vaccinated. So that means that it's the MMR, it's for varicella, which is chickenpox, that's pertussis. It's Florida's school-age population that are children ages 5 to 17. And so when we say fully vaccinated, we mean they've had the whole table that are recommended for school.
And to people who hear cases like they see measles on the news and say it's because of those anti-vaxxer parents, do you have a response to that?
I don't think it's fair to put that on those parents, because even if someone is vaccinated, and we've seen this, I mean, we can predate COVID, but we've seen it with COVID too. But even these, some of these diseases that have been around for a long time, you can't, if you vaccinate, you might be able to slow spread and slow some of the transmission, but it's not a total eradication of a particular illness. But parents need to be the ones to make that decision for their children. So I don't think it's fair to point at any individual and say, well, because you didn't do this, that's why, my child got sick. A county in Florida, any of the 67 counties, if there's an outbreak at a school, then the county health department can declare an emergency and can even exclude students from school who they see on the list don't have their vaccinations, like most of the kids probably do, at 90-something% on average. So there are mechanisms in place under current law that if you had an outbreak, the state and the counties can respond to that and make sure that those children are not there until the declaration is lifted.
Clay Yarborough, thank you so much for your time today.
Yes, sir. Thanks, Scott.